America is in the midst of an opioid crisis, and surgery is often a gateway to persistent opioid use. In fact, statistics show that 12% of patients who had surgery in the past year became addicted or dependent on opioids. Despite the availability of non-opioid pain management options, new research shows that opioids continue to be overprescribed following some very common surgeries.
We're still giving out too many pills for a given procedure. So rotator cuff surgery on the average may get more than 90 pills, and joint replacements are going to get more than 100 pills.
Not surprisingly, surgical patients are concerned about how their doctor will manage their pain. However, despite the availability of non-opioid pain management options, findings in the new A Choices Matter status report find that 2/3 of doctors feel pressure to prescribe opioids.
In medical school and residency, we're traditionally trained to treat post-surgical pain with opiate medication as a first line of treatment. As time's gone on, we've later understood the consequences of opiates and too many opiates.
And opioids can have dangerous consequences not only for the patient, but for family members. Research shows 90% of people prescribed opioids keep them in the house long after they need them.
And we know from research that one of the main gateways to opioid use among adolescents is leftover opioid pills in the house.
Many local governments, police departments, and even some pharmacies have drug disposal programs. And patients are now being encouraged to explore non-opioid pain treatment as a first option.
We should empower patients to ask the questions about what can we do to treat my pain in a non-opioid fashion. I'm not saying that we can get rid of them entirely, but once again, we want to look at opiates as the second, third, or fourth line of treatment.
To learn more about non-opioid alternatives to pain relief, check out planagainstpain.com. For tips on how to talk to children about drugs or talk to a loved one who may be struggling with addiction, go to drugfree.org. Bringing you the best of California, I'm David Wiley for California Life.